think Dr. Prathap has just logged in. Hi, good morning.
Good morning, Kavita. How are you?
Very well. So a big good morning to all our viewers. This is Kavita Prakash from Pilates for Wellbeing. And today I'm going to be chatting with Dr. Prathap, who is a very well-known chiropractor, owner and director of Atlas Chiropractic and Wellness here in Bangalore. Today's topic that we're going to talk about is all about spinal health and how chiropractic practice and Pilates helps one stay injury-free, as well as how both these practices support in healing people and improving one's quality of life. So, welcome, Dr. Prathap. How are you this morning?
I'm doing well, Kavita. And first of all, happy Mothers to you and everybody watching. I'm really, I'm really happy to be joining you this morning. It's a great Sunday to join you all.
It's Sunday morning, but every day seems like a Sunday now, doesn't it?
It kind of does. And, as lockdown kind of continues, we see some relaxation of some of these rules. We have to kind of keep emphasizing the social distancing idea and try to keep everybody safe in the community.
Yeah, absolutely. And, I'm just looking forward to that light at the end of the tunnel. So
absolutely.
Hopefully that should surface sometime soon.
Okay. I'm sure. I'm positive. We just have to keep doing the right thing.
Yeah, absolutely. Okay. Let's get started. So,
absolutely.
Today, as I mentioned, we're going to be talking all about spinal health. So I have a few questions and you have a few questions, I'm sure.
Absolutely.
So
yep.
Maybe we could take turns in asking each other questions, and as we go along, I know people will type in their questions, so maybe we could address that towards the end of our conversation, if that's all right.
Oh yeah, perfectly good.
Okay, great. So would you like to talk a little bit about what chiropractic care is all about? Because I know most of our viewers might not really know what chiropractic care does.
Right.
Yeah.
So, great. I'm happy to answer this. Basically, chiropractic is kind of a virtually unknown situation happening in India right now. It's pretty well known throughout the world, but for India, it's just become a little bit behind in terms of like where it could be, where it should be. Okay, so chiropractic has been around for 125 years. Okay, it was originated in the U.S. And it's had kind of a tumultuous history. But in a nutshell, I'm just trying to make it super simple for everybody. Chiropractic care is the art, philosophy, and science of detecting issues with the body and treating it naturally. So anything you can think of related to a nerve, a muscle, or a joint, part of the bones, a chiropractor can at least have some insider information on that and help you with it naturally. So one of the main tenets of what we do is we don't treat anything with medicine or surgery or injections. So it's a natural form of healthcare that's basically geared towards optimizing your body's function. Okay, so on one hand, we have the therapeutic component. So you have pain, you have a headache, you have something going on where it needs to be fixed. That's one half of what we do. The other half is about wellness, about maintenance of good health. Okay, and that's why we carefully selected the name chiropractic and wellness, because you may not have anything going on per se, like you may not have some sort of condition, but you do notice that your body's not functioning at its optimal. And in this case, a wellness type of chiropractic session might benefit you. So yeah, we have kind of two halves. And to answer succinctly, it's just basically to optimize the body from the brain connection down to the body.
Yeah. And if I understood right, you as doctors are not allowed to prescribe any medicines per se, correct?
Right. So, it depends on the scope of practice, but, like some places in the States, for example, where they have fewer primary care physicians, they are allowed to prescribe certain medications. In some cases, chiropractors are able to deliver children, like things like that. It just depends on the scope of practice. Now, the scope of practice that I'm familiar with, no. Medicine, prescribing medicines and pharmacy, any type of surgery or anything like that, we're not able to prescribe that. In that case, we are considered holistic practitioners.
Okay. Understood. Okay, great. So would you like to go?
Yeah, absolutely. So I guess, in our practice, we've had a couple of our physios who have been, dedicated Pilates practitioners. And one of them even taught Pilates in another studio. So my curiosity was, is Pilates for everyone? And can it be done every day?
Well, to answer your first question, yes, Pilates is for everyone because it is an injury-free practice. It's a low-intensity practice. So having said that, from the time, say a teenager, right from the age of 9 onwards, when kids tend to start taking instructions, we could start teaching them. And since it's an injury-free practice, I would say as long as anybody, can do Pilates, can move. So just to give you an example, our youngest client is about 9 years old, and the oldest that I teach currently is about 82.
Oh, wow.
Yeah, so because it's an injury-free practice, but having said that, we teach a child, we tend to keep the lessons a little shorter because it's a lot of instruction. It's very, very instruction-driven, so you need to make it interesting,
but
interesting enough for a child. And then when people progress with their practice and older people, we go up to about a 60-minute session. So it's very safe to do it, with that wide range of age group. So it's extremely safe. And the next question, sorry, can you remind me what that was?
Yeah, no, I was just wondering, can it be done every single day?
Oh, yeah, absolutely. Because as I said, because it's a low-intensity movement practice, depends on the level that you're working in. So say if you're a beginner or a level 1 or a level 2, so you can definitely practice Pilates every day. But I would recommend that since Pilates is more of a complementary practice, so if a person's doing, say, cardio work on one day, so, could be any form of cardio, could be swimming, running, cycling, etc. So I would say do Pilates on the next day. So combine if there's anything really high intensity that you're doing, you wouldn't want to combine it, to work on one single day. So typically,
but if you sorry, go ahead.
But typically, we have clients who do Pilates about 3 or 4 times a week, and the rest of the days they chose to do, maybe some level of cardio work. So does that answer your question?
Yeah, it definitely does. But I guess my curiosity is just that if somebody was not doing any other type of exercise, is Pilates safe to do on a daily basis?
Absolutely.
Nice.
So it's absolutely safe to do Pilates every day because people really don't it's not a high intensity workout. So having said that, yes, we work focusing on overall development of the body. So even though the movements are a lot intense, but once you're done with your Pilates session, people often tend to feel extremely energized, and they can get on with their day, and they're perfectly fine. So there's no downtime, per se.
Okay. So it's not like a typical workout, like a strength training workout, where somebody might feel sore the next day.
No, soreness is again very relative. It depends on
it is.
a person
You're right.
to person. So it depends, how flexible or how coordinated a person is. But having said that, yes, people can choose to do Pilates every day.
Got it. Perfect. That's good.
So, my next question would be, now I understand, when people come to consult with a chiro, do you all typically rely on an MRI or an X-ray or some form of scan to be able to plan a patient's treatment?
I mean, a lot of the questions you're going to answer me today is it's always going to come down to it depends. Similar to what you were mentioning before, it depends on the person's condition. So, for example, if somebody is coming in to see me and they have, and one of the most typical things that they come in with is back pain with pain radiating down. Either if it's low back pain, it will radiate down the leg, into the buttocks, into the thigh, or if it's neck pain, it might be radiating down to their fingers, where they might have a little bit of weakness or strength loss. So in those cases, I would basically, I would look at that. We would obviously evaluate it in the office, but if there was so those are signals that tells me that there are some forms of nerve compression going on. So those are like trademark, hallmark signs that, you know, something is going on with the nerve here. In this case, yes, I would recommend an MRI. In many cases, they come in asymptomatic as just low back pain, but it could still be a disc. In that case, I may not necessarily recommend an MRI or even an X-ray. Now, what happens is there's a practice that goes on in many clinics around India, and I guess around the world too. And that is, X-rays are usually prescribed anytime there's pain, and that's not necessarily accurate. You know, X-rays are only required if there is some sort of doubt towards bone density or bone fidelity. What do I mean by that? Just if you've had trauma, you slipped and you fell and you landed on your arm and your arm is swollen and you can't move it, chances are it's broken. And in that case, an X-ray would be required, right? But if you just woke up one morning and you're like, oh, my shoulder feels funny, and you go to maybe an ortho or somewhere and they say, oh, let's get an X-ray done, and you do it, it's kind of unnecessary because there was no trauma. There was nothing that would kind of lend the idea that, okay, yes, something happened to the bone overnight. It's impossible. So for that reason, like, we tend to be very conservative practitioners as chiropractors. We don't necessarily recommend everybody run out and get scans and come back and see us. In some cases, it does help. So it's very, very case dependent. It's not necessary that we see an X-ray or an MRI in order to continue with care, but it is a good idea in certain cases. To kind of answer your question in a long but short way, I would let the practitioner dictate whether they need to see an MRI or not. I wouldn't necessarily have everybody go initially get an MRI, come back, and bring that in. It would be easier to just kind of like have a first level diagnosis and get a recommendation from a chiropractor rather than going in with all that stuff. You may not need to spend money on these scans. It might be treatable without it.
Absolutely, because that's what I get to hear from a lot of people, you know, when they visit orthopedic. So the first thing that, you know, a doctor tells them is, oh, you need to go and get an MRI. So, and I'm like, is it really important, you know, to wait for a couple of days? So at least analyze what the situation is and then recommend, you know, people to go and get an MRI or a CT scan or whatever. Yeah.
Well, I just wanted to add one more thing, and that, like, with what we do, we're a physical medicine practice in the sense that we move the bones, we move the joints physically. So certain types of discs, for example, and most of the time I recommend MRI because I suspect a disc. So certain types of discs will need to be treated a certain way. In other words, some discs need to be treated a little bit more carefully. Some discs need to be treated a certain, so we have a rotational adjustment that we do. We have a static adjustment that we do. We can use something called a drop table. We can use something called an activator. And these are all lesser intensity adjustments. So depending on the type of disc bulge, that could also dictate whether or not they get an MRI or not. So.
Okay. Great. Thanks so much for answering that question.
That's not a problem.
Okay.
So in your case, I would really kind of curious, like, my understanding from Pilates so far is like there's this big rig, you know, you either hang from it, you do some leg staff, and like there's something that slides back and forth. I've seen those. But then I've also seen like some of like the celebrities that do, you know, at-home workouts, and they call it Pilates too. So my curiosity is there an equipment-free version of Pilates that can be done at home, especially with everybody WFH?
Yeah, absolutely. Because Pilates is done on the mat as well as, you know, with resistance and support-based equipment. So typically, the version of Pilates that we do, which is the classical form, it's a purist version of Pilates. So that means we work on the mat as well as all other distance equipment that was introduced by Joseph Pilates. Now, typically what I saw in India when I moved in about 5 years ago and set up my studio, yes, Pilates, people did Pilates, but all that they knew was mat Pilates or reformer Pilates. So, and that kind of quite surprised me. And then eventually, after doing a lot of digging work, so I figured out that, they happen to be more from a contemporary school of thought where instructors go through training in segregation. So they either do like a mat work training or just a reformer work training, or maybe they pick another equipment in the Pilates repertoire. But with the classical method that we practice and teach, as a client, you are exposed to mat work as well as all the different kinds of props and equipment that we work with. And as an instructor, you ought to be trained to be able to teach mat work as well as to be able to teach on each and every piece of equipment. The mat work is extremely important, like the equipment work as well. So we lay equal emphasis on both. Now with mat work, it's a lot about, using your own body weight. And with equipment work, the equipment actually supports you as well as offers you resistance depending on, a person's range of motion.
Right.
Yeah. So, and that's one of the reasons when we say mat work, we give our clients homework that they need to regularly do at home, the days that they don't come in to do Pilates. And, and then during these tough times, we are posting home videos on our YouTube channel as well.
Nice.
So people can still keep up their practice with mat work. So does that answer the question?
That's perfect. Exactly what I was looking for. Right. So, would you say that the mat work is a little bit more challenging than like the reformer, or what is that big one called, the Cadillac?
Well, yeah, the Cadillac. You've probably seen a lot of people hanging off the Cadillac and etc. So reformer is just one piece of equipment that we use in the classical repertoire. So that's the carriage that you refer to, which moves up and down. And the Cadillac is mainly used for people who have a lot of, knee issues and who really can't, get down onto the mat. So that's why it's like a bed-like equipment, which has got a lot of springs attached to it. So easier for people, older people, easier for people who are going through rehabilitation or have some kind of... Yeah. So there we go.
Okay. That makes sense.
Okay, great. So moving on. Now, why should a person choose to see a chiro versus an orthopedic?
Right. So this kind of alludes to what we were talking about before. I'm not necessarily saying that one is better than the other. Okay, that's not what I'm saying. In certain cases, I refer directly to ortho. I'm like, you know what? There's nothing we can do about this. This is an ortho case. Okay, but
sorry, let me just quickly stop you there. The reason I'm asking you this question is because I know what chiropractic care is, and I've been doing, getting myself adjusted for many, many years. So very often when people tell me, hey, I have this niggling ache and, I've been doing this and I've been doing that. So my first response most often is, have you seen a chiro? And okay, so why would you recommend a chiro before I can go and see an ortho?
Right.
That's where I'm coming from.
No, absolutely. From where I'm from Canada, and in Canada, it's a very tiered system in the sense that you have to go see your primary care. Let's say you have, back pain, and you have to see your primary care physician, and the primary care physician has to refer you to an ortho. Okay, so it's like a specialized care for specific issues. Now, let's talk about like locally. Like I'm in India right now. I'm in Bangalore, and the idea here is that I can go and see the best of the best in every field. If I have an earache, I can go into an ENT. If I have an issue with my skin, I can go see the top dermatologist. And that's the idea. So everybody wants to go see the most specific person. Unfortunately, what I've seen so far is people returning from orthopedics is that they're not well addressed, in the sense that people are getting very, very superfluous information. Have a painkiller. Okay, come back and get an x-ray. Like we talked about before, like there's no specific advice that they're getting from the ortho. A lot of times people are recommended bed rest, which...
Absolutely. I was just going to say that, yeah. Yeah.
Science has changed a lot in the last 50 years, right?
Yeah.
We know a lot more about the body now than we did then. And I'm not saying that people are not educated. I'm not saying that at all. I am saying, though, however, the evidence points to movement to help you recover from your issues sooner than taking bed rest. I usually make a silly analogy to this point. Like, if your car doesn't start, you don't park it in the garage for 3 months and expect it to start when you try it 3 months later. Your body works the same way. You should be able to activate your body sooner with specific advice. So chiropractic is really cool because we do a very thorough analysis from many different levels. So not only do we take a posture screening and we like basically ask you a very deep interview with you. We check your whole history. We look for this and we look for that. If nothing comes through there, then we're looking at your movement, the body's ability to move through a range of motion, and we assess that based on normals. And then from there, we take you through orthopedic examinations. We look at neurological examination. We touch your body. We actually palpate and see what's moving, what's not moving. So from like just a sheer in-depth level, I would say that chiropractic is looking at things from more than just, oh, you have pain here? Okay, let's work on this. We're actually looking at the whole body, and we're looking at how things have been I won't say misaligned, but out of normal function. So I have a better example for this. Let's say you have back pain. Okay, low back pain. We're going to check your low back. Of course we're going to check your low back, but we're also going to look at your feet. Why would we look at your feet? Because you walk. And when you're walking, if your feet are not being positioned correctly, I don't know, I think the new normal is 12,000 steps that they're recommending, right? So 12,000 steps with a foot that's not sitting on the floor perfectly is going to have an upward spiral effect through your ankle, through your knee, through your hip, and then finally to your pelvis and your low back. So if we didn't check those things, we would be doing a disservice. And unfortunately, when it comes to musculoskeletal issues regarding the joints and the muscles, a lot of times people just cut it short and say, okay, medicine, Medicine is just covering up the symptom. It's not actually looking at why the issue is there in the first place. So if we can delve deeper, if we can look a little bit more at the whole, then we'll find a better solution, which may not require medicine at all. So in that way, I would recommend people, I would look at us as a more conservative version of an orthopedic doctor, in the sense that we're not going to be prescribing you harsh, harmful chemicals that you're going to be ingesting that will have side effects, right? There are no medicines that have no side effects. So this is another major thing. Why not do something on a more natural level and allow your body to get, examined a little bit more deeply before you resort to medicine? So,
I think, again, it's more about people, just understanding what chiropractic care is all about.
Right. Education is very important.
Making that choice of saying, hey, you know what, I want to go and try this out and see how it works for me. Because you never know, a couple of sessions and, you could just feel better. I mean, that's what we see at the Pilates studio as well.
Absolutely.
Little pains. I mean, I know people tend to get a little stressed about, those aches and, little niggles that they have on a daily basis. But there we go. Mm-hmm. Yeah, great. Okay.
So in your case, I'm curious about, you mentioned that there is like a contemporary form and then there's the classical form of Pilates. Now, you guys obviously are doing the more classical Pilates, am I right?
Yeah.
Okay. How would you, I mean, we touched on this briefly before, but how would you compare the two? I know one of them, you just mentioned that it uses the equipment more, right?
Yeah.
But and like, is there like a difference in the training for the instructors that get trained?
Yeah. So typically, as I mentioned now, classical Pilates is the purest version, meaning we stick to the original teachings of Joseph Pilates, who actually founded this movement practice. So
Okay.
there is a set repertoire of exercises and the order in which we teach clients. So we do not deviate from that in the classical method.
Okay.
Okay. So that's one of the biggest difference between classical Pilates and contemporary Pilates. Now, where did that come from? So just like yoga originated from Hatha. And today you have like million different forms of yoga. So the same happened with Pilates as well, but even though there are not like a million different forms, the more contemporary method came into being much later after the movement practice was introduced. Okay? And now, as I mentioned again, with the classical form, we just don't treat each of those equipment in segregation. So when we teach our clients, plus when instructors get trained to be classical instructors, you need to go through the full mechanism of each and every equipment and prop that was used in the Pilates movement practice. But in this contemporary form, they just pick and choose. Even from a certification point of view, instructors can just be mat certified or just reformer certified or maybe just a Wanda chef certified. So we don't work that way. So that's the biggest difference. And then with the classical training, we are a lot more stringent about how to teach. So as I mentioned, it's a set number of, repetitions that we do, set order of exercises that we follow. So it's always quality over quantity. It's just not about getting onto a piece of equipment and just moving the equipment up and down. So it's more about, say, if I tell you, in the classical repertoire, we do not do any exercise for more than 8 reps. So reps of 3, 5, or 8, because again, we're looking at the quality of movement, we're looking at the posture, we're looking at the alignment. So people don't need to do those 1 million reps to be able to feel the burn or to be healed.
Nice.
Yeah, so that's what makes the difference.
You guys train Pilates instructors, am I right? Like there's like an avenue for people who are interested in trying to become instructors. You guys do the training for that?
Yeah, we do that. So we are India's first classical Pilates studio to be actually affiliated to the Pilates Center, which is located in Boulder, Colorado. So that's where the classical school is. So having said that, our certification programs are extremely intensive. So even to be able to teach an intermediate level, an instructor needs to go through a 12-month program. The 12-month program.
Okay, so it's 12 months, right?
Yeah, it's a 12-month program. So you need to do your internship hours at our studio, and then you have an online portal where people can actually go and do their, lectures. Are you there? So I think there's a glitch.
I think there's a small glitch.
In the video, I think.
There is a glitch.
Yeah, there is a bit of a glitch, but I think...
Can you hear me though?
Yeah, I think we can just continue talking. Probably the video might come on soon.
Okay.
So, there we go. So, and again, what happens with Pilates instructors around the world, Dr. Prathap, is it's just not the fitness instructors who actually choose to do this certification and teach Pilates. It's most often the clients who get so passionate about this movement practice because they heal themselves and they see all those fabulous changes that happen in their bodies. So over a period of time, they get sold onto this movement practice, and they are the ones who actually decide to be able to study and eventually teach Pilates. Like, I'm a living example. So that's what happened to me. I used to practice Pilates before I decided to even study and, eventually teach Pilates.
Right.
Yeah.
That's awesome.
Yeah.
I lost you midway, but I got you back now. I think the video is working again. Am I right?
Yeah, I think it is working. So what I was trying to tell you is, I don't know if you listened to the part about, Pilates practitioners actually studying and teaching Pilates. Did you listen to that
Right.
part?
No, that's the part that I missed.
Yeah. Okay. Yeah. So it's not, we're not fitness instructors. So it's not fitness instructors who actually want to do the certification program. So when I
Mm-hmm.
launched the teachers training program in 2016, it was like 5 of my clients who actually decided to study, and now they eventually teach for me, and that's typically what happens around the world, because
Mm-hmm.
people see the benefits, because they say they practice Pilates like 2 or 3, years. They see all those fabulous changes in their body, their injuries,
Right.
they see them heal, that they're the ones who get so passionate about this movement practice.
Right. Right.
Yeah.
So the quality of training shines through, is what you're saying.
Yeah, I mean, the quality of training is extremely important, because, again,
It is.
there's so much, you need to be really thorough with your human anatomy. And
Yeah, absolutely.
typically what I see with fitness instructors here is they just want to pile on, those X number of certifications to be able to teach different movement practices,
Right.
without having to really understand the person that they work with. So that's
Right.
the reason, especially in the class pro form, we always stress that people do a set number of private sessions with us before we can move them onto any kind of a group setting.
Right.
Because one instructor needs to, be fully aware about, of the body that they're teaching. We need to understand everybody's, range of motion, and plus, the fundamentals are super strong, what we instill in the client. So we want to be able for them to take ownership of the practice. So even when
Right.
they move into a group session, so it's not about getting into a big group class and just looking at the instructor and, just working. So because cues are very body specific, and we expect our clients to take ownership of them. So that's why I said it's extremely stringent and highly instruction driven too. So we often tell our clients, hey, you can't leave your brains at home and come into a Pilates class, because it's
Right. It's not autopilot.
no, it's not Zumba, it's not TRX. You're learning about your body, so you need to be mentally present, and that's why it's a mind, body, spirit practice.
Nice.
Yeah.
Got it.
Okay. There. So let's move on. You know, I probably went for my first chiropractic adjustment about, 12 years ago or 13 years ago when I was living abroad. And after that, I just loved what it did to me. But today, I think people are a little apprehensive. Okay, what should I expect when I go to see a chiro? What would typically happen in my first session? So can
Right.
you talk a little bit about that?
Absolutely. Again, chiropractic practices differ all over the world, right? It's based on preference, it's based on setup, it's based on strength, things like that, and how the practice operates. Now, we're what we would call a generalized chiropractic practice. We don't have a specific set of people that we treat only. So, come one, come all kind of attitude.
Yeah.
The idea behind what we do is getting specific to the issue. So if somebody has, I keep going back to low back pain because that's what we see 90% of the time. So it's like low back pain, neck pain, headache. Those are the top 3 things that we see, but we do see tons of other things as well. Anything related to the joints, muscles, anything like that. So the first thing when you walk in, you're going to be greeted by our front desk. They're going to take you through, a little registration process. One of the colleagues, one of the physios or even a chiropractor will come grab you and take you and get your posture screened so that it electronically gets analyzed and we get an idea of like what types of issues might be affecting your body, even before I've mentioned anything to you at all. Finally, your final stop. This is on your first visit. You'll also get your height, weight, your BP check, things like that. And then once you get in with the chiropractor, they're going to be interviewing you in depth about your health history, what's going on, how you've been, what the last 5 years have been like, and what the particular issue that you've come in with is, and all of the factors surrounding it. Now, the more thorough the intake, the more thorough the interview process, the more information we get and the better our brains work in diagnosing what's going on. So after a thorough history, we will go ahead and do a very thorough analysis, whether it's range of motion, whether it's orthopedic or neurological examination. It again depends on the issue that person is presenting with. We'll then, depending on the situation, I have had some people leave without taking any treatment after an analysis. But in many cases, if the analysis shows that, okay, yeah, this particular issue should improve with a light adjustment, we'll do a light adjustment and send the person home. Usually we'll prescribe for a follow-up just to see how the person did, usually within a week or so, and we carry on from there. In certain cases, if required, if somebody's coming in with a previously diagnosed situation, let's say it's a disc bulge again, then we have a particular protocol that we like to follow. Not everybody necessarily gets the same exact protocol, but the idea is that the science is in front of us. The experience and the research has already been done. So we follow that as much as we can. So there is a possibility that you would need to come in for a few visits in order for us to completely rectify the issue. A lot of people ask me, is it going to be cured? And the answer is, well, there's no such thing as a cure. Right? Especially when we're talking about musculoskeletal complaints. There's no such thing as a cure. There's only healing and there's only improvement of function. And basically everything that we do under one roof. So we have chiropractic and physiotherapy, nutrition, mental health wellness. We have acupuncture, dry needling, things like that. And all of those things are geared towards helping the person out whichever angle is required to be fixed. So chiropractic is a main component of that, but if we do need help, we have the practitioners under one roof to help out. So depending on the person's issue, we come up with a recommendation and we offer it. And again, people are under no pressure. People are under, it's not about, sign up now or forever hold your peace. It's never like that. But the idea is commitment. The sooner you can commit to fixing your body, the sooner we can help you, The sooner you've decided that chiropractic care can help you, the sooner we can get to work. It's as easy as that.
Okay, great. Okay, so any more questions for me?
Yeah, sure. We touched on a few things already, and so we now know that you do offer some at-home tips via YouTube, right? We also talked about anybody can technically be a Pilates practitioner or somebody who practices Pilates, anywhere from 9 till older age. That's great. But are there any minimum fitness requirements for somebody to start? Obviously, I mean, as a practitioner and from what I know about Pilates, I wouldn't necessarily recommend somebody with a hot disc starting Pilates. Am I right? But are there minimum fitness requirements for somebody to actively take on Pilates as an exercise?
Well, definitely, I would say before you try any movement practices, it's always good to consult with your physician to see that you're okay to be able to get into any form of exercising regime. With Pilates, as I mentioned, since it's a low-intensity exercise regime, there are no massive movements. It's a lot about, learning to move using your breath. We work on coordination, etc. So unless you have a very serious injury, you've had a surgery recently, I don't see any reason as to why you shouldn't do Pilates.
Mm-hmm.
So unless your physician told you you've had a surgery or say postpartum, now you've just had a baby about, 60 a month ago or so, you might need to get a sign off from your gynecologist to come and do Pilates with it.
Got it.
Otherwise,
right.
we don't set any rules. Again, when we consult with a client for the first time, we do have a client intake form, which is quite comprehensive. So we take in a whole lot of information to see if they have any pre-existing conditions, any chronic issues that we need to be aware of. So we want to be able to kind of stay, true to the practice by way which that we understand the clients that we're teaching. It's not that we just take on somebody randomly. We haven't seen them. We haven't spoken to them. No, we don't.
Right.
Yeah, we
Right.
don't, encourage, clients to work with us that way. So we are very.
It's not a free for all. It's a situation where, and also it's a very instruction based kind of practice, right? So whatever the case is, you're not going to be asking somebody to do something dangerous.
Yeah, absolutely not. Absolutely not. Yes, when people come to us and, they think of us being another weight loss regime, they're like, oh, you know what, I have this, wedding to go for, or this family function to be in, and do you think it can help me lose, these many kilos? So we don't set the wrong expectations at all. I tell them very clearly, hey, Pilates is not about, setting unrealistic expectations. It's more about one becoming aware of their body, learn to accept what you have, and thereon we help you to get where you want to get. So it is a long-term commitment. So we say people need to have patience. They need to sign up for those minimum number of sessions to be able to see any kind of changes in their body. And you need to, stick to your guns. You need to, be consistent with your practice, and especially if your focus is about losing weight, you need to kind of talk to a dietitian, get them on board. So it's a whole amalgamation of things that one needs to do. But sadly, it doesn't work very well in India because people do have unrealistic expectations about their body, and they always prefer to see results quickly. And and I, as a movement practitioner and a teacher today, the first thing for me is to educate people about Pilates. Tell them, hey, this is what Pilates does. So you decide and see if you can support me with, what you want to do, and then I can take you on board and support you with your goals.
Right. Absolutely.
Yeah.
Makes sense.
Great. Now, I know, as I mentioned, that I've done a lot of, spinal adjustments, and I just purely love it. But do you think there are any side effects? I'm sure people do ask you that question. Hey, with regular spinal, adjustments and manipulations, are there any side effects over a long term,
Right.
Yeah.
So this I do get asked this question a ton. Okay, that's very, very true. Typically speaking, if you go to a certified chiropractor, so we have a policy at Atlas. We only hire certified chiropractors that are licensed internationally. Okay, there's no gimmicky guys. There's no people with not so regulated education that work with us. So we have there's 8 chiropractors in all of India right now that currently have this type of licensure, and Atlas Chiropractic hires 4 of them, including myself. So we're strongly we're focused on finding the best practitioners, the most trained and the most well represented. So first of all, you should walk into a chiropractic office with a certified chiropractor like at Atlas without any sort of doubts about what you're going to experience. That's number one. We have well-trained people. They're internationally certified. But number 2, on occasion, there are going to be issues where people will feel sore, right? That's a pretty common situation. We are moving joints around in the body that probably haven't moved like that before. So if that's the case, then, similar to doing a new body movement pattern, let's say somebody's brand new to Pilates or somebody's brand new to yoga or something, when they practice that particular movement exercise, their muscles, their joints, they may feel sore afterwards. That's common. It happens. It's part of your body's adaptation to strain and to stress. So, when we do manipulate the joints, there is a period of maybe 10 to 24 hours where somebody can feel some degree of soreness. It's not the same thing as the pain they walk in with. It's not an exacerbation of the pain they walk in with, but it's more so the joint is responding. The muscles and the things called nociceptors, the little receptors around the joint that say, hey, that's painful. they may respond a little bit in the sense that they feel sore.
Yeah.
At worst case scenario, worst case scenario, we're talking about light joint sprains, we're talking about light muscle strains, we're talking about, and like on the deep end of things, a lot of people have been asking me, well, I read that chiropractic adjustments to the neck can lead to stroke and lead to death and things like that. Well, that is a really, it's a very narrow narrative, okay, that's in the media. Chiropractic is not a mainstream healthcare option in many circles. Even in the U.S. and Canada, we're only used about 12% of the population. So most people are not used to going to see a chiropractor. So when something like that happens with a chiropractor, where, oh, so-and-so went and got an adjustment and now they had a stroke, that is over-sensationalized news. I would be happy to share with your followers at another time a chart that was produced by a research article that was produced recently. You are like, I think it's like 1 in 10 million adjustments may lead to a stroke, and there is no current evidence that shows that chiropractic care and adjustment to the cervical spine actually causes the stroke. There's no evidence about that whatsoever. It does say that in certain cases where a chiropractor may have missed something, like a warning sign that says that, hey, this person should not be adjusted, and that person may have had a stroke already ongoing. So that's something that I want to clear the air on right away. Like, it's a very, very, very minuscule occurrence. To make light of a more dark situation, you have a higher chance of being hit by lightning twice than getting a potentially like issue like that. So I would say that go in and expect no issues to follow.
Okay. And with regular adjustments, I tend to get this. I hear sometimes people saying, hey, you know what, I've gotten so over-dependent about getting myself adjusted, because if I don't go and get myself adjusted every 2 months or 3 months, I just don't feel good within myself. So how would you kind of put that? Do people get over-dependent about, being adjusted, or it's just that, it's a great feeling. It's a feel-good feeling,
There's nothing wrong with feel-good factor. There's nothing wrong with it. It's the reason why spas and other places exist. I won't equate chiropractic to getting a massage at the spa. That's not what we do. But we talked about off the top, there is a wellness component to what we do. Now, I always like to compare it mechanically. So we're mechanical objects, much like your car. What somebody saying that, oh, I got dependent on adjustments, is kind of like saying I got dependent on oil changes, or I got dependent on brushing my teeth.
That's a good one.
It's kind of necessary, We have this thing. It's called our spine, and it doesn't ever get replaced. There's no such thing as a spinal replacement surgery. You can't get one. You have one. You have to take good care of it. Now, the thing is, when people tell me, oh, I don't want to get addicted, it feels so good, doc. I don't want to like get addicted to it. And the truth of the matter is there anything wrong with moving your body to its full potential? There is nothing wrong with that, in my opinion. Okay, so for me, I'm a chiropractor. I see, nowadays not so many, but previously we were seeing somewhere around 300 patients in a week. And for a body to go through that mechanical repetition, that's going to build stress on your joints, on your muscles, on your nerves. So I like to get adjusted every, even sometimes twice in a week if I can, because I feel better. I function better, both mentally and physically. So now, somebody might argue, well, don't you think that's a little bit dependent? Well, I know how I feel, and I know how I function, and I know that if I feel better and I'm mentally clear, I do a better job on my patients. So everybody benefits from me being adjusted. You get what I'm saying? So the idea is simple. Now with coronavirus, everybody's wearing masks. Everybody is, hand sanitizing, washing their hands, which is a good thing. You don't have coronavirus, but you still wear a mask. It's preventative, right? And the same goes for your spine. It's not a like 2 to 3 months is actually a low number. I would recommend everybody with the spine getting adjusted once in a month, because invariably, especially with 50% of Bangaloreans sitting at home, working from home, sitting on their couch curled up, or sitting on their bed all scrunched up, or spending hours and hours and hours in front of their screens. A lot of people are working longer than their 8-hour shifts that they would normally work at the office. So they're just squeezing, and that's a lot of strain and stress on the spine. My recommendation is get that sorted before it becomes a bigger problem, right? We don't, if you don't brush your teeth today, you won't get a cavity tomorrow, right? But we still brush our teeth every single day. It's a maintenance procedure. Yeah, it's a maintenance procedure that's been drilled into our head from day one, right? So what I'm trying to get everybody aware of is that we only have one spine. It does perform a number of thousands of processes every single day for us, and we have to take better care of it. If we don't, we're looking at longer term disasters, and I can't sit around idly and see this happen. So to answer your question again in a long way, there is an addiction factor to the point of I feel better when I get adjusted, and that's not a secret. That's not a secret.
Not a bad thing.
It's not a bad thing at all. Think about it in terms of your family, right? If you are a better functioning adult, you can be a better functioning parent. You can be a better functioning provider. There are fewer risks associated with getting adjusted regularly. Personally, I would take a situation where it's a lifestyle change. I know that I need to go get adjusted, or these things start to happen, right? It's a simple process that to put in to your daily schedule, or to your monthly or to your yearly schedule. It's a good idea. It's a healthy choice. So to the people who are worried about addictions, it's not an addiction. It's a lifestyle improvement.
Yeah, no, I mean, I completely get that, because, say, even with Pilates, very often I get asked this question, hey, how many sessions do you think I need to do, to be able to kind of reach my goal? And I'm like, Pilates is a lifestyle program. It's something that you need to build into your lifestyle, because
Absolutely.
I never did any other movement practice. Continue what you're doing. It's just that Pilates will complement everything else that you're doing.
Right.
To just make you do it better, and then you're in the bargain, you're becoming aware of your body, and then you just enjoy the way you look and feel. And that's what we just tend to talk, on the same lines when it comes to Pilates as well. It's a lifestyle program. I mean,
it's a lot of similarities. There's a lot of mind meld that go on between our two practices.
Yeah.
That's why.
And because, and the goals that people actually set, themselves up with is very short term. So, and I think that's where all this merges from. They're like, hey, you know what? I want to get to that goal. I want to get there as quickly as I can, and that's about it. And then what? Yeah.
Well, I like the fact that everything that you said today, it really ticks a lot of boxes for me in terms of recommendations, right? I mean, we have to look at the current situation, right? We're not going to go back to our mainstream ways of working out anytime soon. I'm not saying that gyms are going to be closed forever, and I'm not saying that you won't be able to run outside forever. But the truth of the matter is, there's more to the body than just building bulk muscles. There's more to the body than running the TCS marathon every year. There's more to that. Right, and if you guys are going to be able to do online sessions for people to do it at home, that's sensational. That's really great.
Yeah. I mean, we haven't gone on to doing online classes.
Oh, right, the YouTube videos where people can follow along. Right.
So I mean, just doing little home videos which they can, do, say, beginning of their practice, whatever else they're doing, and towards practice, that kind of activity. But yeah, there we go. So if you don't have any more questions, I mean, I think I'm done with my questions for today.
I think we've covered a lot of ground, Kavita, today. It was quite awesome talking to you. But one thing that I want to
questions that have come on.
Oh, okay, great.
Yeah, maybe we could quickly look test those. I know the first
Absolutely.
one is quite random. So, I think both of us can answer this. What type of foreign food do you like? So I'm like, that's quite random.
Do we mean foreign food, like foreign to India, or are we talking about like foreign to me?
That's what I think. What one of the viewers wants to know, because I get asked this question very often. Hey, what do you eat?
Yeah.
And I'm like, you know what? I eat a lot of things. I eat
Me
everything
too.
if you ask me. I really don't kind of say no to that and no to this. I just eat a
Yeah.
balanced diet. Again, coming
Yeah.
back to this question, would you like to go first? What type of foreign food?
So I love food, and to be honest with you, the one or two things, if I can't choose between the two. One is Mexican food. I love burritos and tacos. You can give me any number of those and I'll eat them. And the other one is sushi. So.
Okay. Yeah, great. So I'm a pescatarian. I don't eat meat, so just fish. So I love Japanese food. So the viewer who wanted to know what food we eat, there we go.
You can totally bribe me with food, by the way. It's always a good idea.
Okay, I'll take up on that. The next question is, does Pilates help dentists? Does it help in healing neck and back issues? So, I mean, I understand the dental profession requires one to be able to sitting down on their high chair and, peering into their patient's mouth, all through the day. So the posture that they're sitting in can be quite detrimental over a long-term period, so which again gives rise to neck pain and back issues. So having to, exercise their neck and their back regularly will definitely help. And yes, Pilates does help people who do, the same movement over and over again over a period of time, and which kind of gives rise to, aches and pains. So Pilates helps people move in different planes of movement. Say, even the spine, you're looking at flexion, you're looking at extension, you're looking at rotation, and you're looking at lateral flexion, which is supposedly, keeps spine decompressed. So yes, to answer your question, Pilates can definitely help dentists who have